that is, but I don't know if they numb that area, they're squeezing it really hard. Okay. I'm popping in to say, yes, that's the back of an ear. Ears, it's real common to get cysts there because it's pretty oily and prone to just getting blackheads and things like that. That is a perfect looking cyst. It's really nice and round, perfectly round. They made a tiny little opening in it, so you're gonna have to get that whole sack out, but this, I think she may be enjoying this as much because she doesn't seem to bother her. I think you were really grossed out by this. You'd be putting gloves on and things like that. Now you just gotta nick the opening there. I mean, there's no numbing here, which I don't love. You know, I'd be doing this under clean or sterile circumstances in the office. She's got an 11 blade there. I feel like somebody's been watching us. But put that 11 blade down before you do anything, really. Yes, put that thing down. You made a small opening, so it's going to be real tough to squeeze all that out. So all going to come out like angel hair pasta, more so, I think, if you get that. Unless it's sticky. Yep. See that? A tiny little opening. Maybe you made a couple of them. And I bet she's screaming right now. Either joy or disgust. I'm going to guess joy. It looks like she probably enjoys this. But you didn't get the sack out. This is going to have some problems. You got to get that whole sack out. It's probably going to get inflamed and angry. So I think I've said this before, but ear blackheads are some of the most satisfying blackheads. And I get the question a lot, why am I getting blackheads in or around my ear? Well, that is actually one of the most common places to get blackheads because the makeup of the skin, the oil glands, the number of pores, the kind of predisposition to get blackheads is high on the ears, as well as the nose. Those are probably the two most common areas, which is why actually when we do a surgery and say you have an area in your nose that we've had to remove and we have to take a graft of tissue that most matches the makeup of the skin there, we'll often take skin from within or right around the ear to help match the best in terms of the makeup of the skin there. But as you can see, as we're watching this, it kind of keeps going. It's like a clown car. They just keep pulling out of this. So it looks it is actually a lot deeper than it looks. Enjoy. Do you hear that? Oh, you can't even see me. Look at that. Look at that pore strip. It's like a fruit roll-up, first of all. Listen to the sound that makes. I mean, that thing, at least I feel like when it's not paper, I feel like it's going to tear before it tears at your skin, at least. But that looks gross. I mean, throw that thing away, please. Don't hang it in a Ziploc bag on your bulletin board. All right. Okay, what we have right here is, that's definitely a cyst. And they're using a needle tip, really. I think that's like I don't know what gauge that is, but I don't know if they numb that area, they're squeezing it really hard, and they're kind of circling that to increase the opening of that hole, increase the bore of that opening that they did. I don't think they're gonna get the whole sack out, so this is not gonna be a completely successful, I don't know, maybe they do, but that's really squeezing the area. I think if you make a nice incision and you clean that out really well under full anesthesia, that's gonna be a lot more comfortable. I question whether there's even numbing here. I don't like how they take a sharp needle. I wouldn't like to do that. I would want to use more of a blunt object because you can pierce little blood vessels. Ah, this music again. We know what that music means, something very nice and soothing. Here we have a blackhead, or kind of like a dilated pore whiner on the middle of the forehead in a forehead crease using a comedone extractor. It's stuck in there. Sometimes they're stuck in there. I will oftentimes put a little anesthesia in the area, which kind of like lifts and separates the blackhead from the surrounding skin, because sometimes these can be quite difficult to remove. And also that anesthesia will help to numb the area so it's not so uncomfortable for me to try to move that. What is that? A little suction? Is he sucking out of a straw there? I hope not. Are they trying to apply a little like suction to pull that out? And that is a crazy looking tweezer. So it was just sitting right out there. I mean, that would have been relatively easy to remove if we just kind of oiled it up around the area. That's gonna form again though. It's gonna come back. So for all of you popaholics out there, I hear this guy's kind of a popaholic here because apparently he gets real into this. I haven't seen this, but that's what I've been told. And this is a tiny little opening they've made for this. But what do you guys think this is? Put in the comments what you think it is, because I don't think this is just a standard blackhead. And this guy's really squeezing on this. He's just all thumbs, no gloves. It is his own body, but I hope he's certainly cleaned off his skin. But it's gonna sputter.
No way.
This growth is going to sputter because it's a very small hole they're squeezing out of it. It looks like it's a little bit bigger than that. So I think he's could come into some problems trying to remove this in this way because
like that.
He's not going to get the whole entire bump out of there. But it's got some spurting potential here. And I hear the friend is loving it. So it's creating a lot of satisfaction for the people there and probably for people watching it. Oh wow, it's like a little cyst geyser there. A little geyser of skin cells is what it is, right? Those are dead skin cells, macerated keratinocytes.
We are in the middle
look at this guy. He's like, what are you guys doing?
Popping a volcanic
I mean, it's making me sneeze. All right, we have some dilated pore whiners or blackheads here, and you can see they actually have stretched out the skin and kind of moved a little sideways, more superficial in the skin, not very deep. So these are probably true blackheads, not cysts. Sometimes they're kind of like, you can't tell the difference. On the back, this is pretty common in some people, and to soften them up, to make them easier to extract and also to prevent them from getting this bad, you might want to use a good salicylic acid on them. That alpha hydroxy acids, or the beta hydroxy acids in salicylic acid are really going to help to keep those pores clear. There's really good body spray. I have an SLMD salicylic acid body spray that you can easily reach these areas and kind of use the bottle upside down and spray all these areas. So that's really nice, especially like if you can't get to a shower, if you've been working out and you're sweaty and you don't have a chance to take a nice shower. All right, we've got the scalp. I hear this is a young child. I bet you these are the parents. That's why they've got no gloves, and they got this baby. These are like the little tweezers that come in your little kit that you're supposed to take on the airplane with you or something like that. Those are hard to grip, I would say. And I think this is either a pustule, like a little pimple, or maybe even the tip of a botfly or something like that. Now, if it's a botfly, one of the best ways to get it to come to the surface is by, that's a botfly, kind of giving it no oxygen. Like usually people will cover it with Vaseline or something so that it really kind of tries to come up to the surface and breathe. Poor thing, but I bet it feels better after this. Sorry, I was just talking about Nicki Minaj, so I was talking about something totally different here. But here we have some blackheads, and look at that cluster of blackheads. These are called solar comedones because they really occur because of oily complexion and in sun-exposed areas. I bet this person has been out the sun many, many years, and you get all this oil and sebum stuck in your pores, dirt, and so it creates a cluster of comedones or solar comedones. And he's using these nice Q-tips to very gently, because they're so oily and so open and exposed that they're actually pretty easy to extract with a little pressure. It's also really hard to extract in this area using a comedone extractor or putting a lot of pressure, because there's no, when you go within this orbital bone that you feel around your eye, then there's nothing to push against. You can't just push against your eyeball. So it's nice to push against Q-tips to kind of push and extract these. So that's a much gentler way of doing this. If you really wanted to make those easier to extract, I would probably steam your face a little bit, make sure the skin is really soft and sort of loosened up that debris that's within those pores. But you should just start it. I mean, we're not going to be able to see all of this here because there's so much to be extracted in this area. I wish I saw more of these patients in my office because those are very satisfying to do. First, love the nails. Second, I don't know what kind of device that is. So I obviously don't deal with earwax since I'm a dermatologist. I don't know what kind of, I think that's a plastic pliable earwax picker. I don't get earwax like this. I even have one of those little cameras, which you're not supposed to get, but I don't get earwax that gets this big and stuck to you. I don't have that type of earwax. But I'm assuming that this is gonna be a good one. You're gonna pull something out of there. Look at that. That looks like a piece of tape or something. Like a ribbon. Like a, I don't know. I think something flew in there. Like a piece of plastic. Like a little piece of plastic and a little kid. I don't know if that's your wax. Not done popping? Check out this next video or check out my all access membership page to watch more videos.